Run, river, run, run through the hills. Run, river, run to the sea. Run, river, run to your place beneath the sun. Run, river, run over me.
Hi, this is Jan Lewis. Welcome to be my guest today. I am really pleased to have Tracy Krueger with us. Tracy is a certified child life pediatric specialist over at the UMASS Memorial Medical Center. I believe the main center, the children's department there. This is really great. Now, I could go on and on, but welcome, Tracy. What does a child life specialist do for the children?
Sure. So we work with patients and families that come into the hospital setting for any variety of reasons, and just help the experience be more positive, help children and families to have a better patient experience through helping them develop their coping plans that work best for them, given whatever reasons are bringing them to the hospital for the day.
And every child gets the doggy beside you, the stuffed dog?
So every patient that comes in for surgery does, we usually have about 4 or 5 animal types that are generously donated to us through different donors.
Yeah, you'll see the mask, and of course we all have to wear that, what is it, a bonnet or shower cap?
Little surgical bonnet, yep. So we, the children get the animals without the mask and hat, and then they choose whether they want to put that on themselves, or sometimes our OR techs will do it while they're in surgery, so when they wake up they have their animal to take home.
How long have you been doing this?
So I've been at UMass for just under 3 years, and started my career in child life and sort of have gone a whole different path. I started at Mass General probably about 20 years ago, and then moved into education and some home visiting through early intervention, and now have found my way back to the hospital setting.
Wow, so you started at Mass General. That's amazing. And then did you find UMass, or did they find you?
A little bit of both. So, yep, thankyouindeed.com. So,
yeah, that's really great. And she has children of her own. She knows. She brought in the most wonderful flyers. Pre-surgery jitters, shake them off with a pre-op tour. We're going to talk about that one. It's a picture of a little one with the anesthesia mask. That would have freaked me out. I'll tell you about that. And this little stuffed animal with the shower cap that, we all have to have in the mask. And stethoscope. Is that a real stethoscope?
Yeah, they often get a chance to play with the stethoscope that either the nurse or the nurse practitioner or the doctors use.
Has this been at UMass ever since it was built, Child Life?
That I don't know. They've been there for quite a while. We've continued to grow the program. We're up to about 14 or 15 of us on any given day working throughout the hospital.
So when a child is coming in, my parents were jittery and intense, which didn't help me any, but when they come in, do they have to call you first to set this up for Child Life?
So we are contacted by a variety of ways. Sometimes we have parents who know they're coming in for a special appointment, whether it be for blood work or for surgery, and they know that their child's going to be anxious and that they would like that added support. So they often reach out to our department, and we plan to see them. Other times they're coming for a regular visit in our Benedict clinic, or they have a scheduled admission in the inpatient units, and so they'll see a child life specialist as just part of their care. In the emergency room, oftentimes there's a child life specialist there to just meet and greet
so
families.
You can go to the emergency room too?
Yes.
Does one of the doctors or nurses phone you and say, we need you down here?
So we have regular coverage in our inpatient units, our pediatric intensive care units, both the NICU and the pediatric ICU. We have regular coverage in our emergency department, our surgery areas, and both of our outpatient clinics, both at the ACC building and Benedict.
How about procedures? Like, a lot of children are afraid of needles.
Yes.
Other procedures, that we would think nothing of, like an upper barium, you swirl that for an x-ray. Are you there and present for them too?
Yeah, so we don't have regular coverage in radiology just yet, but we do cover consults for them. So oftentimes the ordering physician when they order the test, will put in a consult for Child Life to be there to either contact families ahead of time to help them to prepare their children at home, or for us to meet them the day of the procedure and kind of
that is so
walk
great.
kids through.
Do you work in tandem with the patient? What did I call them? Representatives.
The patient care, patient experience.
Yes.
Yes.
There is patient representatives. Years ago, when I was facing a very serious surgery at UMASS, I was absolutely... I put it off for, 3 or 4 years, and you couldn't put it off anymore. Dr. Kim, hello, Dr. Kim. Thankfully, he set me straight. He showed me the MRI. He didn't make a big fuss. He just told me directly what it is. In other words, it's in your ballpark. You want to get this taken out or not? So I did. But I was petrified. And what I did was, I don't know how I got this into my head, but I called patient reps. And I said, I need somebody to take me like a kid through what I'm going to see. You know, and it happened. They had a gal that was about my age, and she was a lot of fun. Nina, I can't think of it. I think her first name was Nina, and she took me. Back then, I mean, surgery was you went up to the 4th floor, and then they brought you. Okay, so she took me through that. What I would see in the pre-op area, the big room. I can't explain it. It was absolutely fabulous for me. It really was. I thought, well, you know, if they do it for kids, and a lot of us adults are just big kids, we don't get rid of that fear that easy. I got to do something to make it feel. So the day of the surgery, I had bought a autograph dog. I've still got it.
Yeah.
And I had a little squib from a newspaper about the television show I was doing, my co-host and I. I thought, well, I'm going to make this, I'm going to personalize this, because I feel like, you know, they're going to really know. So they brought me down, and I had the dog, and staff was signing it, Dr. Kim signed it, they signed it, and they were looking at the TV thing, and it was just handled so beautifully. I remember saying something like, oh, my tummy doesn't feel too good. Oh, we'll take care of that. Out. The happy juice.
Yes.
That time it knocked me out. The only other time I've had it was, that really knocked me out too. I was just like, oh. And it's not scary. It's like you're taking a nap. It really, really is. They did a wonderful job. Now, if parents would like to reach you over at the Child Life Center, how would they go about doing that?
So they can send an email to us at, you can contact me personally at tracy.krueger@umassmemorial.org, or I have a cell phone that I carried, 508-373-4502. I never remember my own phone number.
Are you there every day, Tracy?
I'm there Monday through Friday about 6 to 2, but then there's additional coverage as well. So they can always call our main Child Life number, which I don't have on me, but...
Right. How many Child Life members are there?
Right now we're up to about 14.
Oh my God, I thought there maybe were 2 or 3.
No, yeah.
14.
Yeah, so we
And they're not volunteers, they are paid.
No, yep, they're, they passion, the Child Life Specialist is usually a master's level degree, and they've completed extensive internship work and completed, successfully passed a national certification exam that they maintain, so...
What college did you go to?
So my undergrad was done at St. Michael's in Burlington, Vermont.
St. Michael's in Burlington.
My master's.
I never heard of that one.
Yeah.
University of the UVM, I've heard of.
Right down the street, so it's a smaller school right down the street.
Did you
from there.
take nursing?
I didn't. I actually, my undergrad is in psychology and elementary education.
Perfect.
Yeah.
You had a perfect. Were you a little nervous the first day you started? Because, well, I want to make sure that these kids are happy and relaxed. Were you a little nervous at first?
Yeah, I think anytime, it's been such an evolving journey. I think anytime that you start a new profession, a new career, you want to make sure that the value add is there for those patients and families, and so making sure that keeping that in the forefront.
Yeah, definitely. You should look downstairs in the lobby at the Upton Library. You see the posters and the flyers. Making hospital visits happier, boy, that is right on, right on. Welcome to the Children's Medical Center. Play opportunities. When my son was up there, he was maybe too old up here to be there, but he was 12 or 13. And it was just an overnight stay. He had the flu or something, so they put him up there. I remember the Child Life man that came in. He was terrific. He's doing his job. He came in and he said, is there something I could get you, like a toy or something? And my son goes, no, I'm okay. He had his, maybe his cell phone or whatever, but terrific. Johnny on the spot. And the play is that the down at the end of the hall? They still have the playrooms.
Yes.
How do they keep the toys clean?
So we do have a lot of volunteers that help. Unfortunately, due to COVID, our playroom has been closed
It has.
for longer than I care to mention. So we've had to get creative and bring toys to kids. The cleaning process continues. So yeah, we can't wait for our volunteers to be able to come back and help us with all of that stuff. But right now, it's yeah, everybody's kind of pitching in and getting it done.
There's a lot going on. I was sharing we're talking with Tracy Krueger, and she is a certified child life pediatric specialist over at UMASS Memorial, and how I've seen Dr. Dixon on the local news channel saying, you know, we're getting stuffed up here with a lot of patients. Is it mainly, you think, because of the ones who haven't been vaccinated?
I think it's just a combination of a lot of things. This is typically a high census time of year to begin with, and then we've added all the complications of the pandemic, from staff shortages to increased illness, and the acuity of illness has gone up. So I think it's really just been a combination of all things not in our favor to keep the census down.
Yeah, definitely. Like if you have a type of surgery coming up that's elective, they're saying, please don't. Not right now. We need the beds. Over at UMass Memorial, at the main campus, they have a children's ER.
Yes.
With a children's waiting room. Boy, have things changed. When I was, 6 years old, I was in Springfield Hospital. You couldn't see your parents maybe 7 to 8 o'clock at night. I remember they brought me down into this long hall. I don't know what I was down there for. And they left me sitting on a gurney. I kept trying to tag people going by, like, can you take me back? Finally, somebody got the message and took me back to my room. That is scary stuff. Yeah, and we were in a room with like 4 other kids. It was not good. Believe me, do parents ever have a problem with they say, well, we can't go in the operating room with them, I don't think. Would you come?
So that's a big part of my job, yes. So parents, normally on normal times, both parents could come in. Right now, because of COVID, we are only able to have one parent accompany a child in. And they're usually in the pre-op area for about 45 minutes to an hour, where they meet the team. The child and I get a chance to meet and form a relationship. That'll frees the parent up to make sure that their questions get answered, and make sure that they fully understand what to expect from the day. They meet with the entire team, from the surgeon to the nurse, the anesthesiologist.
I call him the sleepy doctor.
I tell the kids that's the medicine doctor, so no idea.
I think up there, the last time I had surgery was very serious on an ear, and they put me in room 3, which I think is for pediatric, the pre-op. Fine, that's great. I'll take everything you got. They were running late, which didn't help because you haven't eaten. I don't care how old you are. You haven't eaten, and you're nervous. Now, the later they were, the more I got. Finally, the sleepy doctor, the anesthesiologist comes. He goes, okay. He goes, here comes the happy juice, which scared me a little. I thought, do you completely, go? You don't go haywire at all. I'm like, wow. I said, I feel so much better. My husband said, I gave you a kiss goodbye. Out the door, I was out, and it's done so perfectly. Are children afraid of general anesthesia? I know I was.
I think kids are, depending on the age of the child, their understanding of what's happening is different. But they're very perceptive, so they know something is different. Their morning didn't start off the way they typically do. Here they are. They may have been to the hospital before, but changing into a hospital gown and sitting in a room for a long period of time and having multiple providers come in is all different and unfamiliar. So Child Life is able to provide that normalization of the environment. They quickly learn that we have access to the toys, and we'll sit and play and engage with them while parents are taking care of the medical consent forms and questions. And then, as you said, sometimes we do give some pre-medication to help children's anxiety for that separation from their parent.
Definitely.
So it does take they relax. They feel much more comfortable. Most of them by that point are feeling pretty comfortable anywhere, playing and engaging. And so often Child Life, or myself in particular, in surgery, will accompany the child back to the operating room.
You do go in there, right?
Yeah.
Does that bother you at all? You must have a strong, just to see them go out.
I always say that if I were in the parent's shoes and it was my child going for surgery, I would love to have a child life specialist accompany my child back to the operating room.
Yes.
And not me. So I think for a parent, it is very overwhelming. So it's nice to be able to provide that bridge for the child into the operating room. It's a familiar face. The parent has kindly shared with me all the inside tricks because they know their children best. So singing that lullaby that's always sung at bedtime, bringing that comfort item, whether it's a blanket or a stuffed animal, and making sure that that's close to the child as they're falling off to sleep, is a nice little comfort measure for the child, and being able to prepare that for them. And that helps bridge the gap to the next caregivers. So they, I always introduce everyone in the operating room as my friends, and so children are pretty perceptive to that, of like, well she likes you, I like you.
Do you hold their hand when they're going under?
Yep, they usually hit the little ones often fall asleep in my arms. They're usually sitting and kind of getting a bear hug from me, or if they're a little bit older and they're laying down, they usually will hold my hands, or sometimes we tell jokes.
I think I saw on TV that the caregiver can hold the child, or the nurse holds the child, and they have the little sleepy mask, right?
Mm-hmm.
I saw one time, though, one kid, I don't know when, it was years ago, I was watching something medical on TV, and he was fighting it tooth and nail. That's got to be heartbreaking.
So usually it's a pretty fast thing that happens. Children are smaller than we adults, so as they breathe themselves off to sleep, it's oftentimes like 10 to 30 seconds at most. So they are seated on the table and secure, but then some of them like to be snuggled and some of them like their handheld, and it really just is a child's individual choice and what comforts them.
I know that when I requested the patient rep, they were terrific. She was there. She saw me that morning. I had asked to have, no, actually, she was afterwards. They sent another gentleman down, and I'm getting mixed up. I think it was when I was waking up. He was there, and she came in quickly to see me in pre-op. Mm-hmm. True to form, and they even would find my husband back that. They would find him in the cafeteria to personally go tell him what was going. Talk about concierge service. Mm-hmm. Do you ever come out and tell the parents in the waiting room all is well?
Yes. So, yep, that's usually exactly how it goes. So once the child is asleep, I leave the operating room, circle back out to the waiting room to touch base with parents, let them take that layer of worry off, that the child is comfortable, is asleep, that induction of the anesthesia medication went well, and that the surgeon will be getting started soon. Gives them that extra point of contact, as you said. And then it also is a nice time to clarify. They're so consumed with taking care of their child beforehand that it's hard to remember everything that people tell you in those moments. So having the ability to kind of recap and say the next person you'll see is, expect that to happen at this time. This is how you can reach out to get additional information.
Are you there when the child wakes up?
Oftentimes I am. Yep.
You are.
So
that would be good.
Yeah.
But talk about bonding.
Yeah.
That the child forms a trust with you.
Yes.
This is awesome. Again, Tracy, how can people reach Child Life?
So best way is we do have a website through the UMASS Memorial page, so they can reach out through there. They can send me an email at tracy.krueger@umassmemorial.org, or I have a cell phone that's 508-373-4502.
Music therapy.
Yes.
What's that all about?
Yes, so we have a certified music therapist who works, I want to say 28 hours a week right now. She primarily focuses on our inpatient pediatric floors, and she also focuses on our hem-onc population down in the Benedict Clinic, and she does amazing work. She's phenomenal.
Special events and entertainment?
So we do help to coordinate all the donations, special events. People are very generous and kind-hearted, and about 90% of our programming materials and events are donated.
And I love it that the children who are surgical patients, every one of them gets a stuffed animal.
Yes.
I mean, now, this brings me something that I wanted to talk with Tracy about. I used to volunteer at UMASS, and for years it's gone through my mind. What about adults? An adult life program, because I'm not the only one I know who absolutely was traumatized, I guess, as a kid somehow. Okay, the hospital was seen as the worst place in the world you should go. And it took the loving care, the expertise at UMass when I had that first surgery to see, oh, you can have fun here. This isn't that bad. You get to know your doctor. You know where, at the medical school, big library, you can sit there, you can read, you can get on the line, there's a bookstore, there's a gift shop. I mean, there's just so many things you can do if you want to. But my idea was, and probably going to sound goofy, but for surgical adults, would it be strange to have something on the, I don't know, small animal, something like that, on the pre-op beds, maybe it says UMass on it or something like that? Because I don't know, I would be very fine with hugging a stuffed animal going in. Believe me, I would. Is that anything that would be considered adult life?
That's a great thought. I know our volunteer services does do a lot of different projects and have been contacted by different people. We also have a lot of people who make blankets. So oftentimes patients who have shown up in the emergency room with nothing or coming in for an emergency surgery or just are really anxious, our nursing staff will hand out some of those blankets, comfort items.
When I was volunteering there, I was told, this was a while back, but I told the volunteer coordinator, I said, what about something called surgery buddies? A surgery buddy for adults. Not, the children have it with you and all. How about for adults? And I think she misinterpreted me. I meant volunteer. I didn't mean you have to pay us. But somebody who comes in and will be with the adult or whatever. Maybe they don't have family. Or maybe the family says, please help. They're really a wreck. A surgery buddy, and you could sign up for it if you'd like it. And because I think she said, well, we have to be trained and all this stuff, and the monetary aspect, I'm thinking, don't worry about. That's not what I mean.
Yeah.
Welcome to come in and be trained and all this and that. On a voluntary basis, maybe someday to work into a paid position, but start off as volunteer. See how it works. I don't know. What do you think?
I think anybody coming through the doors of surgery has a level of nervousness and anxiety.
Yeah.
And then,
Imagine walking into the pre-op, and on the gurney, the bed you get on, there's a stuffed animal that says, or a little teddy bear or something, welcome to UMass, something like that. Maybe it has a little hat on or whatever. That personalizes it. That makes it, I guess that's the kid in me, but it makes you feel like, aw, they really care.
Yeah.
Yeah, I think that is so terrific. I don't think the Memorial Branch has that, do they?
Has Child Life?
Yeah.
So we do have one child life specialist who's part-time over in our neonatal intensive care unit over at the Memorial campus.
Oh, they do have that.
Yeah.
Okay. And Hanneman, do they?
So recently we have increased. So when I first started at UMass, I covered 20 hours a week in the NICU and 20 hours for surgery, which was primarily at the university campus. But we are seeing more and more kids over at Hanneman. So now I do 40 hours a week for surgery and bounce between university and Hanneman.
Yeah, there's another, overall in Shrewsbury, there's a new day surgery.
Yeah.
Do you go there?
I do not. No, I don't know I don't know that they do too many kiddos over there right now. The kids are primarily based at university or Hanneman, and our NICU babies stay at Memorial for any surgery.
We're talking to Tracy Krueger, and she is a certified child life specialist. And I was saying to her, you meet the doctors over there, you get to know them. You do. I mentioned one, and she said, oh, yeah. That must be fascinating to meet them and to hear what they have to say. After the child has had the surgery, does the doctor often come back to you and say, this is how it was, I've got to race to the next surgery, but could you tell the parents?
So our surgeons always touch base with the parents directly following a procedure so that they know how it went, what to expect for recovery, what to go over for discharge, and then that's followed up by the post-operative nurse, goes through all those discharge instructions as well. But our doctors always make sure that they touch base with the families directly. But they're often very good about coming by and just saying like, oh, Susie did great, Ryan's doing fantastic. So it's always nice to get that follow-up piece.
Be appreciative.
Yes.
Because when you go in the operating room and you're introducing the child, these are my friends, right? You'll say, this is this person. Because even as an adult, if you're laying there, I was like, oh my God, do I really need this kind of a crew? And that makes it, I can see where that could ratchet up anxiety.
Sure.
So you're being there and the child is already, and then do they get to see their own surgeon saying, hi, this is Dr. So-and-so?
Oftentimes, yes.
They get to do that. Do they kid around and play with the kid a little bit?
Yeah, everybody's really receptive, and it's really very nice. We've done some surround sound wheels on the bus as 2-year-olds fall asleep. We do some guided imagery with some of the kids that are a little bit older.
Yeah.
But it's great. I had one teenager recently who was a big Grey's Anatomy fan, so she assigned us all roles throughout and characters of the show. So she was like, so my surgeon is Meredith Grey, and so just really kind of personalizing, as you said, the experience and helping kids to relate it to something that's familiar and calming is the name of the game. And so yes, we definitely the staff is great. I can't say enough wonderful things about all of them, from the surgeons to the techs in the OR to the nurses on.
I know the surgeons can have music in the background. Somebody got a big kick out of it. Dr. Kim, I didn't know this way back then, but he liked to listen to the oldies. But if you're a child going in, do they ever have the theme to Sesame Street playing in the background?
So we often have, I utilize iPads sometimes to be able to bring a favorite show if that's what's most calming to a child. We also, thank goodness for smartphones, all have smartphones or music systems. So oftentimes the children, especially the teenagers, dictate what goes on the radio as they fall asleep.
Yeah.
So it's great.
Well, we've got about a couple of minutes left. We've been, again, talking with Tracy Krueger, and she is a certified child life specialist over at UMASS Memorial in the Children's Hospital over there. And for parents who have a child who, like when I was a kid, who are really nervous, might not show it that much, but they are wonderful there. And Tracy, you can get in touch with Tracy. She can be there for you, and, get to know you, and then bond with your child and help that child get through the surgical experience. Is there, before we close, Tracy, is there any particular age group that's a little tougher to deal with?
I think I love working with all the ages, and I think from infancy up through the teenagers, everybody benefits from the TLC. So, the interventions change to be developmentally and age appropriate for the kids coming through the doors. But I think, to me, I always have a soft spot in my heart for the teenagers because they feel like they're supposed to be brave and calm. And
adults.
Right. So getting them to open up a little bit and feel comfortable sharing that maybe they're not feeling super calm and relaxed.
If I had to go in again and be knocked out, I prefer to stay awake. I'm just one of those critters. But if I had to be knocked out again, I would love to have Tracy or someone like Tracy bonding with me and going right through it with me. Not because usually your husband or whoever can't come in the OR, but she can. She could be there for your children. Tracy, thank you so much for being on.
Thanks for having me. It's a pleasure.
See you next time on Be My Guest.
Riding on a shooting star, heading out toward a dream. Tomorrow's even closer than it seems.